Hello friends, welcome back to my channel. This video is my 20th notebook of anatomy subject for Neet PG exam. Starting with great auricular nerve. Great auricular nerve arises from second and third cervical spinal nerves. Below great auricular nerve there is transverse cervical nerve. Great auricular nerve is the largest ascending branch of cervical plexus. Auriculotemporal nerve along with great auricular nerve together causes gustatory sweating. It is also known as Frey's syndrome. Broca's area, it is a motor speech area 44-45. It is on inferior frontal gyrus. Wernicke's area is area 22. It is on superior temporal gyrus. Trochlear nerve nucleus is a general somatic efferent column. Trochlear nerve, it is a motor nerve which supplies superior oblique muscle in orbit. Primary auditory area is 41-42. Primary visual area is 17. Part of special viscerant afferent column, that is SVA. Special visceral afferent column includes 7th cranial nerve, 9th cranial nerve as well as 10th cranial nerve in medulla oblongata. Simpson's fascia, it is also known as suprapleural membrane. It is present in the inner border of first rib. 8th rib and 9th rib in between the 7th rib which is connected with the 8th and 9th rib, it is a synovial joint. Example of synarthrosis is first sternocostal joint. Example of synovial joint includes interchondral joint, sternocostal joint, costovertebral joint as well as costotransverse joint. Primary cartilaginous joint or costochondral joint is synchondrosis. Secondary cartilaginous joint or manubrae sternae joint or siphisternal joint, it is a symphysis joint. Aortic opening of diaphragm, the structures are aorta, azygous vein and thoracic duct. Vagal trunk is present at the esophageal opening at T10 vertebrae. Structures at central tendon, that is vena cava opening at T8 is inferior vena cava as well as right phrenic nerve. Structures at T10, that is at the muscular part, that is esophageal hiatus, includes esophagus as well as right and left vagus nerve. Structures in the crus of diaphragm, that is aortic hiatus at T12 includes aorta, azygous vein, thoracic duct as well as hemiazygous vein. Space of Larry, it is known as costocyphoid gap. The blood supply is by superior epigastric artery. Hard palate is a keratinized epithelium. Submucosa and minor salivary glands are present here. Lumbricals, the action is flexion at metacarpophalangeal joint and extension at proximal interphalangeal joint and distal interphalangeal joint. Lumbricals arise from flexor digitorum profundus. There is a medial bipinnate as well as lateral unipinnate supply. Medial bipinnate supply of lumbrical is by ulnar nerve and lateral unipinnate supply of lumbrical is by median nerve. Cricothyroid is a tensor of vocal cord. Abductor of vocal cord is posterior cricoarytenoid. Adductor of vocal cord is lateral cricoarytenoid. Modulator of larynx is vocalis. Safety muscle of larynx is posterior cricoarytenoid. Muscle of whispering is lateral cricoarytenoid. Relaxer of vocal cord is thyroarytenoid. Anterior fontanelle is the last fontanelle to close. Anterior fontanelle closes at 18 to 24 months of age. Posterior fontanelle and sphenoidal fontanelle closes by 2 to 3 months. Mastoid fontanelle close by 12 months. Next is first mandibular arch. It is supplied by trigeminal, maxillary as well as mandibular divisions. Second hyoid arch is supplied by facial nerve. Third arch is by glossopharyngeal nerve. Fourth arch is by superior laryngeal of vagus nerve. Sixth arch is by recurrent laryngeal of vagus nerve. Fibers of iliopubic tract fan out with fascia iliaca laterally. There is thickening of transversalis fascia lying posteriorly to inguinal ligament, which is known as Paupart's ligament. Boundaries of iliopubic tract include medially pubic tubercle and pectineal line behind the conjoint tendon, and laterally by fascia transversalis as well as fascia iliaca. Heart starts to beat from 4th week. Ureteric bud develops from mesonephric duct. Defect in fascia transversalis forms deep inguinal ring. Deep inguinal ring is 1 cm above the inguinal ligament, midway between anterior superior iliac spine and pubic symphysis. That is the midinguinal point. Superficial inguinal ring is a triangular opening in external oblique aponeurosis, 1 cm above and lateral to pubic crest or medial to pubic tubercle. Jaw lock while yawning is bilateral pterygoid. It is attached to articular disc of TM joint. Action of lateral pterygoid is depression, protrusion, side to side movement of jaw. Masseter action is it elevates mandible as well as jaw protrusion. Medial pterygoid action is elevation, protrusion, grinding. That means side to side movement of jaw. Temporalis muscle action is it elevates the mandible, retraction of jaw and side to side movement. Glomerular capillary wall consists of fenestrated endothelial cells, basement membrane and podocytes. Common fibular nerve, also known as common perennial nerve. Nerve root for common fibular nerve is L4, L5, S1 and S2. PDA is due to defect in the left side of the 6th aortic arch. Abdominal pain, jaundice, portal hypertension. These all are due to the anastomosis of esophageal veins as well as left gastric veins. Next is about PDA. There is hyperdynamic precordium, wide pulse pressure, machine-like continuous or systolic murmur, cardiomegaly, hepatomegaly, carbon dioxide retention, renal failure. Longest nerve in the body is saphenous nerve. Sural nerve is an autologous peripheral nerve graft. Collagen fiber consists of bundles. It has rows of chondrocytes. It is known as white fibrocartilage. It is seen in articular disc of TM joint, sternoclavicular joint. Other white fibrocartilage seen structures are menisci, pubic symphysis, manubriosternal joint, glenoid and acetabular labrum. Fibrocartilage does not have chondroblast. There is no perichondrium. Unilateral throbbing pain in the head, photophobia and increased lacrimation, complaints of hemifacial pain on clenching of tooth, pupillary reaction normal, light reflex normal, accommodative reflex normal. Diagnosis is nerve involved is trigeminal nerve. Pancreatic islet cells consist of islet of Langerhans which make endocrine part of pancreas. Blood supply of optic chiasma include left anterior cerebral artery, right anterior cerebral artery and superior hypophyseal artery. Vision loss and aneurysm causes damage to optic chiasma which is by anterior communicating artery. Circle of Willis unites with internal carotid and vertebrobasilar systems. Circle of Willis lies in subarachnoid space. Compression of optic chiasma by anterior communicating artery aneurysm is bitemporal hemianopia. Circle of Willis which causes aneurysm. Investigation is by digital subtraction angiogram. A patient with fever, massive splenomegaly, spleen 15 cm on palpation when measured from right iliac fossa. The ligament here is phrenicocholic ligament. Here there is vertical as well as downward descent of spleen. Splenic flexure of colon to diaphragm. Filiform papillae. There is no taste buds. Filiform papillae consist of keratinized stratified squamous epithelium. Next is a case multiple fracture in the humerus, secondary fall from height. Patient has difficulty in flexion of elbow and supination of forearm, loss of sensation on the lateral aspect of forearm. The nerve affected is musculocutaneous nerve, which is the lateral cord of brachial plexus C5, C6, C7. Musculocutaneous nerve supplies biceps brachialis as well as coracobrachialis. Brachialis is supplied by musculocutaneous nerve as well as radial nerve. Next is patient has jaw swelling, weight loss as well as malignancy. Submandibular gland is resected. Here the lingual nerve which loops around the submandibular duct. Cranial nerves at risk are hypoglossal nerve, lingual nerve, facial nerve. Facial nerve means the marginal mandibular branch of facial nerve is affected. CABG of great saphenous vein. Patient has paresthesia, sensory loss over the medial aspect of leg and foot. The nerve affected is saphenous nerve. Uvula is supplied by glossopharyngeal nerve. All muscles of soft palate except tensor veli palatine is supplied by mandibular division of trigeminal nerve. All muscles of pharynx except stylopharyngeus is supplied by glossopharyngeal nerve. Tumor in the uncinate process of pancreas is supplied by superior mesenteric artery. Anatomical snuff box boundaries are laterally by abductor pollicis longus, extensor pollicis brevis, medially by extensor pollicis longus. Ataxia and incoordination causes thrombosis of superior cerebellar artery. Blood supply of cerebellum includes superior cerebellar artery, posterior inferior cerebellar artery, anterior inferior cerebellar artery. Pretracheal fascia helps in the movement of enlarged thyroid gland on deglutition. Sternohyoid and sternothyroid inhibits the upward extension of thyroid swelling. Thyrohyoid membrane or fibroelastic ligament helps in the upward movement of larynx during swallowing. Meiosis takes place in adult ovary. Ligament of Berry, also known as suspensory ligament, extends from cricoid cartilage to thyroid. Ligament of Berry, which is also known as suspensory ligament, inhibits thyroid gland from sinking down into mediastinum. Extension of metacarpophalangeal joint and flexion of interphalangeal joint is the action of introshi and lumbricals. Long left recurrent laryngeal nerve helps in persistence of sixth arch artery. Dorsal scapular nerve supplies levator scapulae muscle. Ligation of common hepatic artery impairs blood supply in right gastric artery and right gastroepiploic artery. Blood supply of stomach, that is celiac trunk branches, include left gastric artery. Splenic artery, which includes short gastric arteries as well as left gastroepiploic artery. And thirdly, common hepatic artery, which includes right gastric artery and gastroduodenal artery. A patient with weakness on the right face, loss of pain and loss of temperature on the right side, pain and temperature on the left leg is also lost. Lesion is on the lateral pons. This is known as lateral pontine syndrome. There is an involvement in anterior inferior cerebral artery. LMN lesion causes lateral pontine syndrome and UMN lesion causes lateral medullary syndrome. First costal cartilage and manubrium is by fibrocartilaginous joints, that is synarthrosis. Second to seventh costal cartilages consist of synovial joints. Popeye sign is the tendon rupture of long head of biceps brachii. Hill-Sachs sign is complication of anterior shoulder dislocation. The posterolateral surface of humeral head is also affected here, which is due to repeated impact against anterior glenoid rim. Grisinger's sign is edema in the posterior auricular soft tissues overlying mastoid process which causes thrombosis of mastoid emissary vein. Grisinger's sign is a complication of acute mastoiditis. Primary cause of increased inguinal lymph node is anal cancer. Microscopic examination of elastic cartilage shows chondrocytes within lacunae, elastic fibers in the matrix, and perichondrium with outer fibrous layer and inner cellular layer. Hyaline cartilage shows bluish opalescent, it is type 2. Elastic cartilage will be yellow color, it shows type 2, and fibrocartilage is white color which shows type 1 mainly, and also it consists of type 2. Examples of fibrocartilage include TM joint as well as sternoclavicular joint. Atlantoaxial joint, normal rotation is 40 degree. Atlantoaxial joint, median atlantoaxial joint is central pivot joint. Lateral atlantoaxial joint is plain synovial joint. Projection fibers are internal capsule. Callode's triangle boundaries are medially common hepatic duct, inferiorly cystic duct, superiorly cystic artery. Most common site of injury in Callode's triangle is in laparoscopic cholecystectomy. Callode triangle contents are lymph node of Lund, that is sentinel lymph node of gallbladder, and branching of cystic artery. Omphalocele is physiological hernia. It is failure to go back, that is non-closure of the umbilical ring. Mandibular foramen is by the inferior alveolar nerve. Extensor carpi radialis longus is supplied by radial nerve C6-C7. Extensor carpi radialis longus is supplied by radial recurrent artery. Action of extensor carpi radialis longus is extension and abduction of wrist joint. Function of lumbrical is flexion at metacarpophalangeal joint and extension at both interphalangeal joint. Cantley line is cholecystovenocaval line in the right and left lobe of liver. Skin consists of 15% of total body weight. Epidermis is derived from ectoderm. Dermis consists of type 1 and type 3 collagen. Structures at the aponeurosis of external oblique muscle include pectineal ligament, inguinal ligament, lacunar ligament. Median lobe of prostate forms uvula vesica. Foot drop is the damage to common peroneal nerve. Linea semilunaris is aponeurosis of internal oblique muscle. Decurvine stenosynovitis is the inflammation of extensor pollicis brevis and abductor pollicis longus. Boundaries of anatomical snuff box include medially by extensor pollicis longus, laterally by abductor pollicis longus and extensor pollicis brevis. Roof is by cephalic vein as well as superior branch of radial nerve. Floor is by radial styloid, scaphoid, trapezium and first metacarpal. Content of anatomical snuff box is radial artery. Iliopsoas muscle is attached to lesser trochanter of femur. Flexor carpi radialis arises from the medial epicondyle and it inserts on the palmar surface of the base of the second metacarpal. Blood supply of flexor carpi radialis muscle is from the anterior or the posterior ulnar recurrent artery. Common carotid artery pulse is assessed at the level of cricoid cartilage. Malleus is derived embryologically from the first pharyngeal arch. A 60-year-old male patient is brought to emergency department due to a suspected stroke. Patient has difficulty forming words but can make noises and give expressions as if he understands the questions asked. The type of aphasia most likely present in this patient is Broca's aphasia. It is also known as motor aphasia or non-fluent aphasia. First, carpometacarpal joint is a saddle type of synovial joint. A schoolboy presented with wrist drop. Here, the nerve affected is radial nerve. He had a history of trauma to his upper arm in the past. The nerve mainly affected is radial nerve. A female patient presents with complaint of pain over the anterolateral aspect of thigh after normal vaginal delivery. The nerve injured in this condition is lateral cutaneous nerve of thigh. It is suggestive of myalgia paresthetica. The serosa is absent in the esophagus except in the intra-abdominal part. Pringle's maneuver is a technique where the free margin of the lesser omentum is compressed to obtain rapid control of hepatic artery and portal vein in liver trauma and surgery. This Pringle's maneuver helps to distinguish hepatic arterial and portal venous bleeding from hepatic vein bleeding. A patient had his molar teeth extracted, following which he developed loss of general sensation in the anterior two-thirds of the tongue. The nerve likely to be injured is lingual nerve. Popeye sign, it is seen in the rupture of proximal tendon of biceps. Popeye sign is on flexing the elbow, there is an extremely prominent bulge of the muscle belly as its unrestrained fibers contract. Vertebral level of the plane between highest point of the iliac crust is L4 to L5. The plane passing through the highest point of the iliac crest is known as supracristal plane. A 39-year-old patient presents to OPD with complaints of pain over his ear lobule. He also complains of difficulty in eating food and the inability to close his eyes completely. On examination, there is a swelling below his ear. The nerve most likely to be involved in this condition is facial nerve. Talus bone ossification center appears in the 6th month of intrauterine life. A patient sustained an injury to the head and now presents with blood collected around his eyes. Attachment of aponeurosis leads to blood collection around the eye, which is known as black eye or raccoon eye. Brunner's glands or duodenal glands are compound tubular submucosal glands present in the upper duodenum above the sphincter of OD. Brunner's glands are seen in duodenum. A 55-year-old man is diagnosed with left testicular carcinoma. In a patient with testicular carcinoma, para-aortic lymph nodes are the first to be involved. Islets of Langerhans makes up the endocrine part of the pancreas. Cleft lip is due to failure of fusion between the medial nasal prominence and maxillary prominence. Umbilicus corresponds to the level of the junction between the third and fourth lumbar vertebra. The skin around the umbilicus is supplied by the thoracic spinal nerve, that is T10. Framework of external nose is by the upper one-third bony part and lower two-third cartilaginous part. A patient presented to OP with an abnormal gait. On examination, when the patient was asked to stand on the left foot, a right-sided hip drop was observed. The muscle paralyzed in this patient is left gluteus medius and gluteus minimus. The examination of the patient indicates a positive Trendelenburg sign, that is, the patient presents with Trendelenburg's gait, with sagging on the right side. A patient presents with a cyst on the neck anterior to the sternocleidomastoid at the junction of upper and middle third of the muscle. This cyst is due to persistence of second cleft. A patient is referred to a higher center with the diagnosis of fracture. On examination, the forearm pulses were not palpable. Upper X-ray was also taken. The radiograph showed closed fracture of the shaft of the humerus. The brachial artery is the most commonly injured artery in this condition. The radial nerve is commonly damaged in this condition. It manifests as an inability to dorsiflex the wrist and digit, that is, wrist drop and finger drop. Numbness occurs on the dorso-radial aspect of the hand and dorsal aspect of the radial 3.5 digits. Management of humerus shaft fracture include using a hanging cast or U-slab for 2 to 3 weeks followed by functional bracing. Surgical fixation by compression plating, interlocking intermedullary nail, semi-flexible pins or an external fixator. A body ridge felt when palpated a few centimeters from the suprasternal notch represents the angle of Louis or sternal angle. The sternal angle is between the T4 vertebra and upper half of the T5 vertebra in the majority of adults. The lienorenal ligament, also known as splenorenal ligament, it contains the splenic artery. The nerve supply of larynx above the level of the vocal cord is by superior laryngeal nerve. Transitional epithelium is seen in urethra, urinary bladder, ureter, as well as renal pelvis and calyces. The deepest layer has columnar cells, the middle layers are made of polyhedral cells, and the surface layer has cells that are large and shaped like an umbrella. This is the transitional epithelium. Fracture at the medial epicondyle damages the ulnar nerve. The nerves related to humerus are axillary nerve at the surgical neck, ulnar nerve at the medial epicondyle, radial nerve at the spiral groove of the shaft of humerus. A man is brought to the emergency department after falling from a height with his hand outstretched. X-ray shows a clavicular fracture. The junction of medial 2/3 and lateral 1/3 of the clavicle is most likely to be fractured. The radius and ulna are united by 3 joints: proximal superior radioulnar joint, middle radioulnar joint, and distal, that is inferior radioulnar joint. Proximal and distal radioulnar joints are uniaxial pivot joints and are involved in pronation and supination movements of the forearm. Radioulnar joint belongs to syndesmosis. The posterior tibial artery is palpated between the medial malleolus and the calcaneal tendon. The great cerebral vein of Galen drains into the straight sinus. A woman presented with sudden onset of dysphagia, dysarthria, and gait ataxia. MRI revealed an acute infarct in the right dorsolateral medulla. Likely diagnosis is Wallenberg's syndrome. The symptoms of dysphagia and dysarthria are due to the involvement of nucleus ambiguus. Ataxia is a feature of inferior cerebellar peduncle involvement. Medial medullary syndrome is known as Dejerene's anterior bulbar syndrome. Lateral medullary syndrome is known as Wallenberg syndrome. Medullary tegmental paralysis is known as Babinski-Nagote syndrome. Midbrain stroke syndrome is known as Weber syndrome. Thyroid gland extends from vertebral level C5 to T1. Proximal and distal radioulnar joints are uniaxial pivot joints which is involved in pronation and supination movement of the forearm. Subcostal plane is at the level of the upper border of the third lumbar vertebra. Supraspinatus action is abduction of the shoulder joint. A patient underwent a left submandibular gland excision during which the hypoglossal nerve was injured. In this patient, we can see deviated tongue to the same side. A hypoglossal nerve injury would damage all muscles of the tongue except the palectoglossus, resulting in deviation of the tongue to the same side. Since the left hypoglossal nerve is injured in the above scenario, the tongue will deviate to the left side. A newborn had hypoplasia of the mandible and zygomatic bones, malformed external ears, and slanted palpebral fissures. Abnormality in the development of pharyngeal arch 1 will lead to the condition known as Treacher-Collins syndrome. C cells or the parafollicular cells of the thyroid gland secrete calcitonin. The neurovascular plane of the abdominal wall lies between the internal oblique and transversus abdominis in the anterior abdominal wall. The medial side of the leg and medial malleolus is supplied by the L4 dermatome. In infants, the termination of the spinal cord is at L3, following which the cord moves up with the age. The fallopian tube is lined by ciliated columnar epithelium. The vertical plane that divides the body into anterior and posterior part is known as coronal plane. The trachea is a tube-like structure that allows air to pass between the larynx and bronchi. The trachealis muscle is a smooth muscle located at the posterior wall of the trachea. It connects the end of the C-shaped tracheal cartilage rings and completes the posterior part of the tracheal wall. A patient with leprosy presented with extension at the metacarpophalangeal joint and flexion at the interphalangeal joint of the ring and little finger caused by ulnar nerve injury. It produces a claw hand that is main in Griffey. Leprosy can affect peripheral nerves and lead to associated conditions. In ulnar nerve palsy, only the medial two fingers develop clawing, while in a combined median and ulnar nerve palsy, all four fingers develop clawing. The ulnar nerve supplies the medial two lumbricals in the hand. Tests done to check the integrity of the ulnar nerve include Igawa's test, book test or Fromen's sign, card test. Navicular bone is interposed between the head of the talus and the cuneiforms. There are 7 tarsal bones. The proximal row is made of talus and calcaneum. The distal row from medial to lateral contains the medial, intermediate and lateral cuneiforms and the cuboid. Failure of the anterior end, that means the cranial end of the neural tube to close, is known as exencephaly. As a result of this, skull vault does not form. This leaves the malformed brain exposed. The exposed brain tissue degenerates, leaving a mass of necrotic tissue. This defect with the absence of a major portion of the brain, skull and the scalp is known as anencephaly. Neurulation refers to the process of the formation of the neural tube from the neural plate. A newborn presented to NICU with respiratory distress and meconium discharge from the umbilicus. The condition occurs due to patency of vitello-intestinal duct, which connects to the primitive gut to the yolk sac. The primitive gut is connected to the definitive yolk sac through a narrow stalk-like communication known as vitello-intestinal duct. It is also known as vitelline duct or yolk sac or omphalomesenteric duct.